Where are we at today, Kesia?
Hey, you guys. Welcome to Key and Will's The More You Know podcast.
Okay.
Today, we are here at board-certified dermatologist Dr. Darren K's office. He's right here off West Paces in Buckhead. We're going to be talking to him today about what? Botox. Cosmetic options. All right? So you guys come on in and join us inside. Today, we are here with Dr. Darren Casey in the Buckhead location. Dr. Casey, what's the address for the location here?
Hey, Key, we're at 1218 West Paces Ferry in Atlanta, Georgia, right near the OK Cafe.
Yeah. So. Dr. Casey is a board-certified dermatologist here in Buckhead, and today our topic is about Botox. So Dr. Casey is a wonderful educator, and I wanted him to just share information about the Botox process, what it is, what it means, and I'll ask some other questions about it. So Dr. Casey, thank you so much for having us. We really appreciate you sharing your busy schedule with us today to talk more about Botox. So tell us, what is Botox?
So interesting is that Botox is one of the really most outside-the-box inventions in the last 50 years. There were a husband and wife dermatologist team, and they realized there was this protein. The protein was produced by a bacteria, and interestingly, it was bacteria, botulinum bacteria. And so when sort of potato salad goes bad, someone figured out, well, it isolates a specific protein. So they had some patients that had some painful spasm in their face, and they said, well, this protein will block the muscles. Maybe we can, provide some comfort to these people. So the spasm is called blepharospasm, and it was around the eyes. And so literally on week number 1 of their study, they injected the right or left side of people's faces, and within 48 hours, they started getting phone calls saying, oh my God, my wrinkles went away. Literally,
miracle.
The pain was gone, but within that week, they started another study looking at the effect of this protein Botox and how it would change the way that faces age. So we now use Botox for the frown area, for muscles in the frown area, for foreheads, and for crow's feet. In the past 30 years, that has also morphed into a method for blocking pain, blocking sweating, blocking migraines. So Botox really, with more and more outside-the-box thinkers, has really extended what it can be used for.
Sure.
In today's discussion, we talk about Botox and its effect on aging. So specific muscles of our face. There are some muscles called the corrugator muscles. They're right above the inner eyebrow. In between the eyebrows, there's a muscle called the procerus muscle. And these muscles together cause us to frown. And as we frown, we pull in and we pull down. Repetitive motion over a lifetime will eventually break up the collagen to cause wrinkles in the area. And also, more importantly, it tends to cause drooping of the brow. Our brow, through time, gets lower and lower and lower. So by using Botox, we prevent that motion. We let the face age in a more subtle way, and we've done it together before, so I think today's the day where we're going to touch up your Botox.
Exactly. How often do you recommend someone get Botox?
Well, the first time someone does Botox, a first timer, the Botox will probably last about 3 to 4 months. On the outer end of the spectrum, lucky people may last 6 months the first time, but probably 90% of people, the first time is 3 to 4 months. Each time they do Botox, because you haven't used the muscle gets slightly thinner, and so Botox starts lasting longer. So we can have Botox, within 2 years, last 5 to 6 months for most patients. One of the nice things is as we get the wrinkles to go away, a lot of people notice that their eyes look more rested. For people like me who get tension headaches, since we don't hold tension in our brow anymore, our tension headaches go away. So there's lots of, nice perks. I would tell you that 90% of my patients come to me first to deal with lines. Some people call them the 11s because there are these two lines that happen between the eyes. But every patient that comes back says, Dr. Casey, give me back my lift. Because about a week after, you wake up and you just feel rested, and you look into the mirror and you see yourself. You see your former self.
Yeah.
You without stress, you without fatigue. Yeah. And I think that's what makes Botox so inviting.
Yeah, I think because I have so much expression, and through the years, along with aging, you start to notice these lines, and you're like, where did they come from? And then you start to compare yourself with other folks who may not have these lines. But I think one thing about it is you don't know if someone has had Botox before or if that's just natural and they didn't have these age lines. So I think it's just interesting that, some people will have these lines naturally and then some people do not have these lines. Have you seen that, or what do you think about that?
With enough time, most people would make some of these lines.
Sure.
But it has to do with how you communicate. I was raised, I'm half Italian, so I have a hard time not using my hands. Right. As a doctor, we try not to, so you can be more open, but automatically the hands start moving.
Yeah, of course.
And as your hands move, so does expression. Sure. So some people actually emote by bringing their brow together. Other people emote by saying, oh my God, and saying their eyebrows up. Well, those people who emote using these muscles, repetitive motion is what sort of wears out your collagen. Almost like a well-worn pair of jeans that the knee wears out. So we need Botox in people who specifically use that expression repetitively. Right. But there's always a tincture of time. At a certain age, we start noticing lines that weren't there before.
Yes.
And in our mind's image, who we are, that isn't there.
Yeah,
and so now we can, with very little pain, with very little effort for the patient, a week later, have that smoothness.
Yeah, absolutely.
One of the more exciting things that's happened with Botox is more recently they've shown that it actually has an effect on people's mood as well. Because we sometimes judge ourselves by what we see in the mirror. We wake up in the morning looking fatigued. We start feeling fatigued. They've shown that an area of Botox, this area in the frown area, for some people can be as effective in improving mood and depression as 6 weeks of an antidepressant.
Really?
Because that person's self-image improves. They see their eyes look rested. They were communicating with themselves sometimes through our own image, through the own mirror. So when we look, there's an old Billy Crystal, my darling, it's always better to look good than to feel good. We want to feel good, but it's great to look good too.
Absolutely, absolutely.
Just that.
Oh yeah, that's interesting to know. I didn't realize that. So Dr. Casey, we know that Botox is an injection, as you mentioned. Talk to us about, are there side effects or anything that folks should be worried about because of this going into their system, so to speak?
Sure. So Botox was approved by the FDA 30 years ago. Okay. We know that when we put into specific muscles, the nerve and the muscle can't communicate. So if it's injected into the appropriate muscles, you get the appropriate effect.
Sure.
So in this area, we're going to inject muscles that just pull the brow in and down. If we stick with those muscles, when we relax them, automatically the brow goes up and out, making you look rested, making you look softer. If we used muscles that are needed to raise the brow, we took away the lift of the brow, then you could be too heavy. So there are some no-no areas.
Sure.
So we don't inject Botox on the outer face. I'm a person who doesn't like to inject Botox around the mouth, but in more simple muscles that have one or two motions, if that motion doesn't have a positive impact, we can temporarily stop that motion.
Okay.
When we do Botox, normally there's a little bit of your followers will see there's a little bit of redness and swelling that'll occur for about 3 to 5 minutes. That swelling is because Botox is injected along with some water. As your body reabsorbs the water, the swelling goes down. And then the protein takes about a week to have an effect. So on day 4 or day 7, you'll notice that it's hard to frown and you wake up feeling rested and even when you're not. That's the key.
At least you look rested.
There are always new products coming out, but right now I'd say that I'm happiest with Botox brand. There are several other generic medicines that are FDA approved, but each doctor has what they favor.
Their preference.
Yeah, preference.
And what they've seen work.
Correct. Reproducibly.
Sure.
And it's all about reproducing to the best of our ability exactly so we can predict and inform a patient what they're going to see.
Yes, absolutely. So another question, Dr. Kesia, and then we'll move into showing the Botox process. So I've asked you before, of course, again, as I age, I start to see these lines and things that I, don't like because I hadn't seen them before. One thing I'd ask you about previously is, I'm starting to notice the under eye lines. Mm-hmm. So I'm like, Dr. Kesia, what can we do for my under eye lines? Can Botox be put there? And you let me know that, that's not something that is
usually done.
Exactly.
Correct.
And because there are...
So in certain muscles, like there's the muscle called the orbicularis oris, and it's the muscle that surrounds the eye. Yeah. Well, from the edge of the eye out, it's responsible for crow's feet, which you don't have many of. Mm-hmm. But that same muscle goes from the corner of the eye in towards the nose. If we were to inject the muscle under there, you wouldn't have the ability to move the orbicularis muscle at all. Mm-hmm. People would notice some eye swelling, and it would not have a desirable effect.
Sure.
You'd feel like you had bags in your eye for 6 weeks. So
it's the opposite of what we're trying to do.
We choose to not inject. And that's what a good injector will know is how to best advise. It's always good for the patient to ask for their wishes, and then it's our job to help interpret their wishes in the safest, most effective way. Right. For under the eyes, for you, I would say we want to do a good job of using moisturizers, some things that might exfoliate, because we don't want to take away all motion under the eye. These are muscles that are important for other reasons, like making tears and moving tears.
Sure.
When they stop moving the tears, you see some swelling.
Yeah, absolutely.
So, yeah.
Okay. All right. Will, any questions for you about Botox? Do men get Botox, Dr. Kesia?
Yeah. So, now I would say that about 45% of my patients are males.
Oh, wow.
What's interesting is that women will often start doing Botox mid-30s, early 40s. Okay. For men, they enter the arena in their 50s. Men want to always stay at their peak. We don't mind having some of these little gray hair, as you can see.
Sure.
But when we start feeling too much like the silverback, we don't want to seem like a dinosaur. So men in their 50s and sometimes 60s start things like Botox filler or caring about aesthetics, whereas before they didn't. We start thinking about it then.
Yeah. Okay. Oh, that's interesting. I didn't know that there would be a high percentage of male or men who were interested in Botox. So we'll make an appointment for you as well.
All right.
All right, Dr. Kesia. So I think let's
ready to get started?
The process.
Yeah,
absolutely. So I'm gonna sit back, you guys.
So I get a little more back support.
Yes. So yes, Dr. Kesia, we have done this on me probably about 4 or 5 times, I'd say, the past year. I enjoy it. I haven't had any issues at all. I enjoy it because of the way that it makes me look afterwards. Because I think I don't frown that I'm aware of, but I do show a lot of expression. Even when I'm just sitting and I'm watching TV, I notice myself kind of having more tension in my forehead or just holding my face a certain way. And I think that, maybe that's caused some of the lines that I do have. But
another thing to think about is if you found yourself in a restaurant kind of having trouble with the menu, sometimes people will squint just to be able to see print as they're not seeing their eyeglass doctor enough. So if you're squinting more at the TV, it may be that you need some distance vision glasses. So
that's for sure.
that can definitely make a difference in how long the Botox lasts. Because if you're recruiting and using other muscles, then we don't want to have a negative impact on
that's true.
your effect.
Absolutely.
So with Botox, it's actually a very fragile protein. So it's mixed up always just before we use it. before we do it, we always want to clean the skin.
Okay.
We never do any injections just in case you touched a doorknob and touched
Sure.
your face. We always have to have no bacteria on the surface.
Okay.
So if you close your eyes, because I use some alcohol to clean off the brow in where we're going to do our Botox.
Now, Dr. Casey, if I were getting Botox for migraines or pain, would there be different muscles that you would inject?
Yeah, so besides this frown area, we would do probably the crow's feet muscles.
Oh, okay.
And then on top of that, we would do sometimes some parts of the forehead as well as wherever your trigger is. So some people's migraines always trigger from the right temple or left temple, and so we put a few units of Botox into the trigger points. And then migraines are reduced by about 50 to 60% at first 3 months, but eventually 6 months. So normally when Botox is done for migraines, although the initial realization that it would help was seen by dermatologists, it's now done by neurologists. So normally when people go for migraines, they'd have a neurologist do it.
I see.
Yeah.
Okay.
So next we're going to do the Botox,
Okay.
and we're going to inject first into the corrugator muscles. And if you remember, Key, I'd like you to give me your meanest, angriest scowl, something reserved for husbands who leave socks out. So, and then I'll be relax, and I'll do the first injection. 1, 2, 3, and ouch. Okay.
And it's not painful at all.
Yeah. Give me another angry frown, and then relax. 1, 2, 3, and ouch. Now we're doing the procerus muscle. Okay. And I like to split, ouch, that injection into the two parts of your procerus. Okay. Turn your head towards me a little bit more. Now give me again that angry scowl. Perfect. And then relax. 1, 2, 3, ouch. You can see there's a little bit of swelling on air. Give me another angry frown, and then relax. So now putting a tiny bit into part of the, ouch, lower foot of the frontalis muscle. Ouch. And angry again, and then relax. 1, 2, 3. Okay, so we're done injecting.
So, Dr. Casey, what on average is the typical cost for Botox?
Well, it varies state to state and city by city. So normally for the area we've done here, it's going to range anywhere between probably $350 and maybe $500 for Georgia.
Okay.
But the same thing in New York City is going to run $700 to $800.
Sure, yeah.
Just perhaps the real estate is more expensive, or
Yeah.
or they get away with charging more.
Exactly.
So I actually have patients that still come from New York. It's sometimes cheaper to get a flight to Atlanta than to have a new doctor in New York.
Yeah.
So if you remember, after I do the Botox, I like you to work the muscle by kind of frowning and relaxing. That's from a few studies that showed that working the muscle would get you to absorb a few more units. Thank you,
I'm
Ashley.
used to frowning, am I, Willie? I don't normally frown, so it's kind of hard for me to.
Depends if the socks are left around.
Yeah.
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 So how long will it take for that swelling to go down?
About 3 to 5 minutes. So
Okay.
yeah. So
Not painful at all, you guys. The injection is kind of feels like a little pinch, but not painful at all.
yeah, most people think compare it to almost like they feel like maybe plucking an eyebrow, and some you don't even feel that much.
Yeah, exactly. Now, Dr. Casey, another question I have for you is we've done fillers for me before. So you guys, I tend to have a smile. I guess we do. Are they called smile lines?
Some people call them smile lines
The parentheses.
or marionette lines. So called marionette lines, and this fold from the nose to the mouth. You'll often see this in people who have very low fat contents. So I see it in triathletes. I see it in very in shape people,
okay.
and sometimes even before time would make the face drop, you'll see that the shadowing occurs.
Yes.
But having a very prominent line here does make people perceive that your face is older. So by filling in that area with certain fillers, the face just looks softer, and it tends to be more smooth.
Sure.
So we look for elliptical shapes as opposed to demarcations.
And so fillers are different from Botox, though.
Yeah.
That's a different
Yeah.
injection.
So fillers can be proteins or polysaccharides, things like sugars,
Okay.
that are injected. There are also some doctors also do some artificial fillers, some that are based upon bone or ground up suture material. And what they do is they replace parts of us that are missing. So as we age or as we burn calories, we use up some of our hyaluronic acid.
Yeah.
So the filler I used in you was something called Juvederm, which was a naturally occurring hyaluronic acid that replaced what you were missing. It lasts for 6 months, and then even that is digested because it's bioidentical to what's in your body already. So as your body digests it, we just replace it.
Okay. And fillers are the cost for fillers.
Fillers, it depends on how many cc's someone has to use.
Yes.
So in Atlanta, the going market is probably, $600 to $700 per cc. Depending upon how artistically you place it, you can do more or less with a cc.
Yeah.
So some doctors need 2 cc's to fix these folds. Other doctors, if you place it correctly, can do it with 1 cc. And so the price can vary, again, based upon how much volume you use.
Of course.
But normally with a cc, I can soften from the nose down to the mouth, and sometimes even a little bit below.
Absolutely.
Yeah.
Okay, perfect. Well, Dr. Kesia, this has been awesome. I do want to make mention of, I trust Dr. Kesia with these cosmetic options for me, again, because he's educated me very much so about these.
Okay, I want to make sure that you and your listeners always make sure that when they have things done, make sure it's with a board-certified doctor, someone who specializes in using these products. More and more, you can go to a strip mall and find somewhere where you can find a person who will inject you legally or semi-legally. But I would always make sure that you place your face in the hands of someone you trust.
Absolutely.
So look for that board certification.
Yes.
And then you'll be safe.
Yeah. Again, I trust you. I appreciate you always keeping me informed about things that I ask about and what my options are as it relates to some of these cosmetic options. So Dr. Kesia, for our listeners who would like to maybe make an appointment here with you at your office, tell us about how someone can reach you.
Sure. Well, the name of our practice is Atlanta Dermatology, and they can go to www.atlantadermatology.com and make an appointment to find out more about just skin rejuvenation and what fits that person. Botox, filler are not cookie cutters.
Right.
They fit certain people. So I like people just to come in with an idea of what's bothering them, and we talk about what's the best and most simple and cost-effective way of fixing those things.
Yes.
I think we, over a lifetime, have earned trust for each other.
Absolutely.
So thank you for having me.
Yeah.
And I like to go forward and hopefully
explore more options.
as we need them.
Always open.
Yeah.
You guys, I do want to make mention before we wrap. Dr. Kesia not only talks to me about these cosmetic options. We talk about skincare as well and things to do to keep my skin beautiful and clear. I suffer from acne for so many years, and Dr. Kesia has really helped me through that journey. So thank you again so much for all you do for me and for Will, because he has to look at this face. So
through the eyes of love. Okay.
So again, thank you so much, you guys. Thank you for tuning in to this episode of Key and Will's The More You Know. The concept, you guys, is when you know better, you do better. So we want to just bring you as much information as possible about things you can do to make a healthier lifestyle for yourself. So have a great day. Make sure you like, subscribe, and follow us. And we will also, Dr. Kesia, if you're on Instagram, we'll make sure to share that information as well.
Sure. Thank you.
All right? Okay. Thanks, you guys. Have a great day. Thank you, Dr. Kesia. This was great. That was good. I told you, Dr. Kesia.
Yeah.